Good evening, everyone, and welcome to what I hope will be a lively question and answer session around some of the facts, figures, and maybe some myth busting to do with the COVID-19 vaccination. My name is Tony Gravett. I am the manager of Healthwatch Plymouth, and I've been asked to host this event. I'll go through some etiquette rules before handing over to the presenters. But firstly, what I'd like to do is just to have a quick mention about Healthwatch and what Healthwatch is. So Healthwatch Plymouth is one of 148 local Healthwatch, and we are the independent consumer champions for people to give us their experiences of using local health and social care services. We take that feedback and we work with commissioners and service providers to try and make those experiences better for members of the public, and that could be with your GP surgery, your pharmacy, with the hospital, with care homes. And our overall lead with that in the country is Healthwatch England. So we have a feed into them so we can raise local issues to a national level as well. And recently Healthwatch England has produced some reports on NHS dentistry and GP access during this COVID pandemic. On the panel tonight, we have Ruth Harrell, who's the Director of Public Health in Plymouth, Sue Wilkins, who's an Associate Chief Nurse at University Hospitals Plymouth NHS Trust, but is also the lead for the mass vaccination programme within Plymouth. And hopefully, in fact, he's joined now, we have Dr. Alex Deegan, who's the Primary Care Medical Director at NHS Devon Clinical Commissioning Group. Those individuals will give some presentations shortly to give you some information about COVID, the latest status, and some facts and figures before we go into a question and answer session. I'd just like to remind everybody of some etiquette for this. So you would have been sent an email when you registered with some sort of, let's call them very loosely, rules for the event itself. We will keep everybody muted, and when it comes time for the question and answer session, we will ask you to put your hand up. That can be done if on the bottom of your screen in the reactions. If you click on that, there is an opportunity to raise your hand to ask a question. I will bring people in as those hands go up. And when you are asked to speak, if you could just say your name, then ask your question, then I'll ask one of the panel to answer that. So without further ado, and probably a little bit ahead of schedule, I'm going to hand over to Ruth now to give a presentation on the general COVID situation, mainly focusing on Plymouth, but with some national context as well.
Lovely, thank you very much. And I know some of the faces and the names already, so I know some of you will be aware of this. But I just wanted to give you a quick overview of where we are in Plymouth and what the situation is. Ellie, I'm going to be doing a bit of a Chris Whitty here and asking Ellie to put my slides up and then forward them. So if you hear me say next slide, please, I do apologise. So on the next slide, please, I've just put here some of the curves that I'm sure you'll be pretty familiar with from all of the briefings that we get from the government, really. So this is the top one is the UK cases. And of course, when we had the first wave back in March, we weren't testing everybody. So that bit of the curve looks a lot flatter than it really was. But then we got testing sorted out in the volume that we needed, and you can see that we had a quiet summer, which was fantastic, but then cases started to increase. And obviously the pattern that you can see with those two waves across the UK, they are largely what happened over the winter, and the reduction that we see in between is, and the reduction now, of course, has been created by the lockdowns. So we are now at that right-hand side of that curve, where we know that the lockdown has made a huge difference in making the case rate fall. Just that simple thing of isolating each other, keeping each other apart, has made a huge difference, as you might expect. And then the curve below, I've done the same thing, but with hospital admissions here. And obviously the reason why is because the real concern, although cases are a concern, particularly if you hear the stories of people that are having long COVID, but in particular, we're worried about people who have serious illness, of course. And so the hospital admission rates are shown in the curve below. And you can see both how high they went in the two waves, but also how good they're looking at the moment. So there are still people being admitted, but a much lower rate. And on the next slide, please, with this one, I've zoomed in on what's happening in Plymouth in green, in the southwest average, which is the blue line, and against the England, which is the red line. And this curve just shows you the number of cases, or the rate of cases, I should say, from October until where we are now. And as I know you'll be aware of, we've spent quite a lot of the pandemic at or around the southwest average, and occasionally dropping even below that. And that in itself is a huge success, because obviously we're a city, we've got high population density, we've got lots of essential work that's been going on even through lockdowns. So that's a real positive. And it was quite interesting in the last peak to see that we had a bit of a slow response when we went into lockdown. And I know I felt quite concerned, because at the point where I was really hoping we'd be seeing cases drop, which was happening in England, we actually had a little rise. And what we now know, and what we talked about at the time, is of course that there was a variant, the new variant that was coming from, we call it the Kent variant, but it's properly known as B117, was moving across the country. And it was about that point that it hit us, and it's more transmissible, so it was more easily spread. But luckily the lockdown worked, and you could see that we then dropped really well. And currently we are at a position which is a little bit below the southwest average, not much, but a little bit, and less than half of the England rate at the moment. So we are looking very good at the moment, but it is still important to know that that's still a real number of cases. It's not zero, and it's not gone away. It is still there, but it's looking really good. So in terms of feeling slightly optimistic at the opening up of the economy, I think it's, we're probably in the best place that we could be. And then on the next slide, this is a little bit complicated. This is a heat map. And what I'm trying to show here is the age profile. So up this side, this is like a patchwork quilt, where up this side is age groups from 0 to 4, 5 to 9, 10 to 14. Each of these lines represents a different age group, right up to the 90 plus. And when it's dark, that means there were a really high number of cases. And what we tend to see, what we've seen all along, is that the cases start to get higher in the sort of younger working age population, generally speaking. We start to see that spread. And they're often people that are in quite low paid work. They're probably in the kind of work where they have to be out and about. They're probably in a type of work where they have to be somewhere rather than being able to work from home, which sometimes comes with being a little older and perhaps a little higher up the salary scale. But unfortunately, of course, what we've seen before is that it then spreads, and it spreads up through the older working age population. And then unfortunately, it gets into the older people who are, of course, very vulnerable to COVID. And we've seen that happen very clearly in both of these waves, and you can see that it did get quite difficult in the January wave, as you'll be very well aware. But if you just look to the right, what you see here is largely pale colours. And obviously there's two things that are really good about this. One is that the lockdown has reduced the cases altogether. So we're not seeing any of those dark colours. Even in our younger populations, there's none of the dark colours at all. And of course, we're seeing these nice pale colours for really for anyone over 60 or so. The rates are really low. And that is really positive news. And so, as I say, puts us in a good position at the moment. So on the next slide, this is the number of people the patients in hospital, in our hospital in Derriford. And again, I'm showing you this to show you that, or to remind us of how bad it got, how difficult it got. So having 110 or more patients in hospital for an infectious disease was incredibly significant when we were at the peak before, but also to see how positive it's looking at the moment with those very low rates. Now, obviously, part of that is that the cases are low at the moment, but also part of that is the fact that we are now able to say that our older population and our more clinically vulnerable population have got some protection from the vaccine, which is obviously what we're here to talk about, and fantastic news. And so as we move forward, we know that rates of COVID are probably going to go up and down a little bit. They're not going to be completely static. We're not going to stay at this minimum forever. But what we hope we won't see so much is this translation into so many hospitalizations because of the benefit of the vaccine. And I also wanted to mention the death rates, because, you know, this is a disease that's killed something like 150,000 people across the country, and that's going by the death certificates. Either the primary or the contributory cause has been COVID. In Plymouth, we are at around 80 per 100,000, and that compares to England as being less than half. And again, so a lot of things that we can be really positive about in Plymouth, and that we can be you know, relieved, if you like, and feeling slightly optimistic that the next steps in the roadmap for us, we're starting from a very good place. I have one more slide on the next slide, and I know that we probably wanted to focus around vaccination, but I just wanted to put one slide up about testing, and that's because I'm wanting to just promote a little this testing of people who don't have any symptoms. So routine testing of people who have no symptoms. It's a rapid test. It takes less than half an hour from starting the test to getting your results. And we are now promoting this really heavily. And the idea is that we want to normalise people taking a test. And of course, that's because there's two reasons people might have COVID and might not know about it. One, because they genuinely may have no symptoms, or symptoms so mild they don't notice them. But also because you can spread it before you get the symptoms as well. So for 2 or 3 days beforehand, you can be transmitting it. And this will pick most of those up. The way the tests work, it's not quite as good, as accurate as the PCR tests that are the ones that have to go off to the laboratory and take a day or two to come back. But obviously they are a lot easier to do, a lot cheaper and easier to do, and they can be done really quickly, and they give you that quick result. So home testing kits are now available for people. We're pushing them out through as many sources as we can, really. So many workplaces are giving them out to their staff. We are providing them through a community testing programme, and you can see in the picture there our mobile testing van, which at that point is out in the Place to Breast in the city centre by the Barclays Bank. And we will be continuing there. We're going to be moving into probably a porter cabin, but we will be continuing in that location for some time. And also pharmacies have really got behind this, and that the map that you can see on the other side just gives you an idea. There's no detail, you won't be able to see detail, but gives you an idea of the vast number of pharmacies across the city that are also now able to give out home testing kits. I think we're up to about 50, which is brilliant. And people can also order them at home. So I just wanted to put that there because of that sense that at the moment, our way of trying to tackle this virus, there's no one silver bullet. There are going to be, lots of different ways in which we need to work together to tackle it. And so I wanted to promote that. So that's all I was going to share in terms of setting out the position. And I will hand back to Tony. Thank you very much.
Thank you, Ruth. We'll move on to the next presentation now, which will be a double act between Alex and Sue. and we'll talk about the actual vaccination and the process of that within Plymouth and the achievements they've made so far. But we'll also talk around some of the things that have been in the news recently around side effects. So, Alex and Sue.
Thank you very much indeed, Tony, and good evening to everyone, and thank you for joining us this evening. My name's Sue Wilkins. I'm the Director of Mass Vaccination, which might sound like I've hung around and waited for this opportunity to have a job, but it hasn't been like that. I'm actually the Associate Chief Nurse in Plymouth, and I've been semi-redeployed to lead the mass vaccination response across Plymouth, and I'm really, really proud to do that. And I think it has been an absolute time for Plymouth to be proud. So as well as everything else we're going to discuss this evening, I hope you'll, I hope by the end of the evening, you'll understand that the Plymouth response has been something for us all to be absolutely proud of. And I think I'm going to have some slides come up now. So I'm going to hand over to my colleague Alex quite shortly, but what I'd like to do, if we could just go on to the next slide, is just outline what we are hoping to cover this evening. So we're hoping to give you a greater understanding of the vaccines. There's already 3 vaccines in play and more to come. So we absolutely understand that this is pivotal. This is what people need to see. We want to explain why we see it as important without sounding like we're doing a sales pitch. We absolutely appreciate that having a vaccine is a huge personal decision, and we talk very much in healthcare about individualized care. We want people to make those personal decisions, but we're suddenly asking people to do something in the context of a wider population, and that's quite deviant to how we would normally deliver healthcare, and it can at times be a little bit uncomfortable for us that we're saying, well, this is a decision that we want you to make, but we want you to think about the wider population as well. We're going to discuss some of those side effects and contraindications, and there's so many out there. Not a day goes by without me walking through the corridors of Derriford or out in the streets, and people asking me about various myths about whether side effects were associated with the vaccine or not associated with the vaccine. So hopefully we're going to cover some of that this evening. Helping people make the right decision. Well, we absolutely want people to make the right decision for them, and one that they feel comfortable with. And this is where I really think information is key. And then we're bound to have forgotten something. So there'll be plenty of time for questions at the end. So without further ado, I'm going to hand over to Alex, and you'll come back to me very shortly. Thank you.
Thank you, Sue. I know Tony's already introduced me, but for those of you that don't know me, my name's Dr. Alex Deegan. I'm a GP, actually at the opposite end of Devon from where most of you are from, but I have a role as medical director for primary care across the whole of Devon, including Plymouth. And I've also been involved in setting up a GP vaccination service close to where I work, as well as being involved in kind of the strategic oversight of the vaccination programme across the whole of Devon. I'm hoping to give you a bit more information on the vaccination programme, and in particular as a clinician, keen to tell you a little bit about how the vaccine works, and also have a discussion and give you a bit more information about some of the side effects. As has already been alluded to, there's been lots in the media, particularly over the last couple of weeks, with regards to AstraZeneca. So hopefully I can give you a bit more information on that. So first, you'll see on the first slide there, the number of people that's been vaccinated in Devon. I think I have to say, I've been immersed in this every day since December. It's really been a monumental effort from everyone involved in this, and I'm talking about the GP practices, the hospitals, some of our other kind of trusts and partner organisations across Plymouth, and also the public as well, who have really played their part in coming forward and getting the vaccinations when they're being invited. So you'll see that over 650,000 people in Devon have been vaccinated. We started vaccinating back in December. Seems a lifetime ago, really, So in 4 months, we vaccinated over 650,000 people, including over 127,000 in Plymouth itself. There's a bit of detail there on the numbers for Plymouth. You'll see, and you'll probably know actually, that initially we were targeting those most at risk from COVID. So it's those individuals that are most likely to get severe infections that might result in hospitalisation, admission to intensive care, and death. And by and large, age is the most preeminent factor in that. So we started off with our most elderly and those with various medical conditions at particular risk, and you can see the numbers there. Now, you might look at the under 50s and think, actually, why have so many under 50s been vaccinated when actually we haven't got to them? Well, we have got to them yet, because the government have announced today, actually, haven't they, that 45 to 49-year-olds can come forward. But the reason why there's so many under 50s that have been vaccinated will be because actually people like NHS workers and carers for local authorities and carers, people that care for family members as well, came in some of those initial 9 cohorts that we vaccinated already, and that's why the under 50 seems perhaps a larger number than you might expect at the outset. I think the government set out to have offered a vaccine to everyone over the age of 50, I think in a couple of days' time, and I think they announced today that actually they beat that target by a couple of days. In Devon, we think that we've offered vaccination to everyone that's entitled over the age of 50. As I just alluded to, that there has been an announcement today that we're moving into a lower age group. So I think 45 to 49-year-olds has been announced today, and then actually we'll be going to lower ages to I think initially to 40 to 45s, and then even lower under that, depending on the kind of delivery schedules of vaccines that we get into the country. And I expect we'll hear more about that over the next few days and weeks. But we're expecting to be able to offer vaccination to every adult over the age of 18 by the end of July this year. Ellie, could you just go on to the next slide, please? Thank you. Again, many of you might have heard in the media that that there's been a bit of a lull in supply in April, which is correct. So I think we were expecting to be vaccinating more people with first doses in April, but there were some supply issues that meant that's been paused. However, anyone that's actually got an existing appointment for either a first or a second dose in Devon, if they got an appointment, that appointment will remain in place. It's really important that they attend as planned. I've mentioned second doses, that the majority of the doses that we've given have been first doses. Again, the guidance that many of you may know is that we should be giving second doses between 3 and 12 weeks after the first one. By and large, because of supply, actually most people will be getting their second doses about 10, 11, 12 weeks after their first one. So you can see actually we started vaccinating back in December, so plenty of people now are at and beyond the 12 weeks, so quite a large number now will have had their second doses. And it's really important to remember that we get a good amount of immunity from our first dose. It takes 3 or 4 weeks to build up that immunity after our first dose, but really important to get that second dose done to top up our immunity and get as much immunity as we could. And you'll see there that Stephen Powis, who's the National NHS Medical Director, is encouraging everyone who's eligible to come forward. We really need to make sure that we vaccinate it as large a population in Plymouth and more widely in Devon and the rest of the country as possible, to make sure that we all have as much protection as we can. And I'd say that anyone, sorry, just the last point there on that slide, if you know anyone who's over the age of 50 who hasn't been called yet, I'd encourage them to either book an appointment through the national booking system online or to call 119, and the service there should be able to help you. Thank you, Ellie. Can I go on to the next slide? Thank you. So the next slide is just why should I have the vaccine? I think Ruth alluded to the fact earlier that actually the vaccination programme isn't the panacea to all of our problems. We need to do lots of things to reduce COVID, protect as much of our population as possible. So it's not just about the vaccine, it's about social distancing and all those other things that we're familiar with now. Vaccination is just one part of it. Having said that, vaccination is probably the most important part, and I like to look at this in two ways, actually. So it is about protecting ourselves. So if we have the vaccination ourselves, we protect ourselves, we reduce the risk of us picking up COVID, but also we protect others, and particularly our loved ones who we come into close contact with a lot of the time. And for those of us that are younger, perhaps the risk of catching COVID on an individual basis is lower. But actually, if we're socialising with our parents, our grandparents, our family members with heart disease or diabetes, actually by being vaccinated and immune ourselves, we're reducing the risk to those people as well. So it's about individual protection. It's about protecting others who we come into contact with, and about protecting the population even wider than that. The MRHA is the official UK regulator. It's independent, and it assesses not just vaccines actually, but all medications. So they look at the evidence from trials that's come out, and the MHRA have been very clear that the COVID vaccines are safe and highly effective. Having said that, whenever any new medication comes onto the market, it's really important that actually we carry on monitoring it after it's being used in the wider population to pick up any issues. But it is a safe vaccine and very effective. Sorry, not just one vaccine. We've got several vaccines, haven't we? But the vaccines that have been approved are all safe and effective. Thank you, Ellie. If I could go to the next slide. Okay, thank you. So how effective are the vaccines? I've kind of covered a little bit of this already, actually, in a previous slide. But the first vaccine gives us really good protection. As I said earlier, it takes about 3 or 4 weeks to build up a degree of, or a decent degree of immunity. But by having that second dose, we top up our immunity levels, and actually it gives us longer lasting protection from COVID. Yeah, again, as I alluded to earlier, no vaccine is 100% effective, and that's why it's really important that we vaccinate as many of our population as we can be. Sorry, as we can do. But you'll see there that if we have the vaccine, it's 80% effective at reducing the likelihood of hospitalisation, including intensive care admission and death. And we will all have heard over the last year about why it's important to reduce COVID levels and social distancing, to reduce levels in the community, and to protect the NHS, because actually by vaccinating the population, I mentioned earlier, we protect ourselves and our loved ones, but also protect those services in the NHS, and actually not just in the NHS, but other services as well in the local authorities and other kind of businesses in the community as well, which are also really important for our kind of prosperity as a region. Again, I said earlier that it's not just about vaccination. So really important to follow social distancing and to cover our mouth and face. Thank you, Ellie. If we could go to the next slide. Okay, so this is just a brief slide to explain how vaccines work. So I've already mentioned, in fact, Sue's mentioned there are 3 vaccines now that have been that's been approved in the UK, and we're expecting 1 or 2 more to come online over the next few months. All the vaccines are slightly different, and some of them work in slightly different ways. But essentially, what all vaccines do is to essentially trick your body into thinking that it's come into contact with the virus, and it actually stimulates your body, your immune system, to develop antibodies, which many of you will have heard of, and things called T cells, which are really important in our immune response to all sorts of infections. And by coming into contact with the vaccine and developing those antibodies and T cells, actually, if and when we come into contact as individuals with COVID-19 virus in the future, our body is ready and primed to protect against it and to fight off the virus before it can take hold in our bodies. Just the last couple of points there. I mean, all of the ingredients in the vaccines are available on the NHS website if you want to have a look at that. And one question I get asked quite a lot is whether the vaccines contain any animal products, but they don't. Thank you, Ellie. If we could just go on to the next slide. So side effects. This is what's been in the press a lot, the media over the last couple of weeks, isn't it? So like any medicine that I prescribe medication on a daily basis, but like any medication, vaccines can cause side effects. We know that. Over 30 million people in the UK have had their first dose of the vaccine, and reports of severe side effects are really, really rare. So again, you might remember right at the beginning of the vaccination programme when we were using Pfizer, where Pfizer was the only one that was approved at the time, people were reporting potential allergic reactions, like anaphylactic reactions. But even they are really, really rare. And as time goes on, we get to know more about the side effects and their likelihood. Now, the majority of side effects are really mild, and I can say that having had the vaccine myself, and also kind of running a vaccination service at my end of the patch, and seeing my patients who have had the vaccine. Most people get relatively mild side effects. So the most common side effects are a sore arm, an achy arm, where the vaccine's injected. Some people can feel a little bit tired, bit of a headache or feeling achy, but generally, I know it says there that they don't normally last more than a week. Generally, it lasts 24 to 48 hours in my experience. And I suppose the other thing, as a GP who's really closely involved in the programme, is that I've had so many comments from my patients and from patients from other practices and other parts of Devon who have been desperate to have the vaccine, so pleased to have it done, and sending lots of thank you messages and complimenting Plymouth on how well run the service is. People by and large have been absolutely delighted with the service, which has been great. Sorry, I went off track a little bit there, telling you about the feedback I've had, but I've got another couple of slides on side effects. Ellie, could I just go on to the next slide, please? And perhaps these 2 slides are the ones that are most pertinent at the moment, because this is what we're hearing about at the moment, isn't it? So there've been concerns raised about blood clots. So I think it's really important to stress that adverse reactions following vaccination are really rare, and really rare with the AstraZeneca one. Now, it says there, by the end of March, over 20 million doses of AstraZeneca had been given in the UK, and actually the risk of blood clots is really small. It's less than 4 people in a million who receive the vaccine. And I think one of the things that we don't know at the moment, and may become clear over the next few weeks and months, is whether the AstraZeneca actually causes the blood clots, or whether those blood clots would have happened anyway. So we need to do a bit more work to understand that. I did read the other day that actually you're more at risk of coming to harm by driving to your vaccination than by having an AstraZeneca or any other vaccination. And again, I think we need to remember it in the context of actually we've had, I think, 79 cases of these blood clots that have been identified. But if you compare it to the number of deaths, which Ruth mentioned earlier, 120,000 deaths, kind of weighing up the potential risks and benefits. I and the MHRA and I think all other clinicians would still advise that people have the AstraZeneca. I can't remember, Ruth may be able to comment, but the vaccination program already has I think Public Health England have done some work estimating the number of lives it has saved, and it has saved thousands and thousands. Might ask Ruth to come back on that when we come back to questions, if that's okay. And just going on to my last slide, Ellie, just a little bit more about blood clots. So what the advice that the JCVI, so that the Joint Committee of Immunisation and Vaccinations, have given in light of that recent evidence about blood clots is that although it's really, really safe to be having AstraZeneca, they've advised that anyone under the age of 30 who hasn't yet had their first dose should probably be offered an alternative. So it's likely to be Pfizer or Moderna, which is the new one that's just been approved, or maybe one of the other vaccines that comes online over the next few weeks and months. For over 30s, the balance of risk is still very much in favour of AstraZeneca. So the advice at the moment is actually, if you're over 30 and offered a vaccination, it doesn't really matter whether it's AstraZeneca, Pfizer, or Moderna. Having said that, that they have recommended that if someone under the age of 30 has already had a dose of AstraZeneca without having any serious side effects, rather than switching to Pfizer or Moderna or one of the others, their second dose should be with AstraZeneca. So again, at the moment, the advice, except for a very few exceptions, is that if you have one vaccine for your first dose, you should have the same vaccine for your second dose. It may be that in due course that advice changes, because I know that there are trials going on, not just in the UK but elsewhere, looking at the effectiveness of having a different vaccine for your second dose. But at the moment, the advice is that except in very few circumstances, you should have the same vaccine for your second dose as your first one. And just the last point there, that the only people who shouldn't have a second dose of AstraZeneca are those that have had a clot on their brain or other major blood clot in association with a low level of platelets with their first dose. So platelets are a constituent of your blood, which essentially helps your blood to clot. These clots that have been associated with AstraZeneca tend to be associated with low levels of platelets, which would be picked up if you were admitted to hospital or attended your emergency department with symptoms. So at the moment, those are the only people who shouldn't have a second dose of AstraZeneca. And I think that's the end of my slides, Ellie. Sorry, I might have gone on a bit longer than intended, but I'll hand back to Sue now, I think. Sue, you're on mute still, Sue.
Gosh, someone had to do it in the course of the night, didn't they? And I didn't want it to be me. There you go. If the slides could go back up, and I think we're on slide 11. Thank you very much indeed. And going to talk about pregnancy, fertility and breastfeeding, sort of under the same umbrella, really. And what never helps is when a situation changes, when advice changes, but it's really not surprising that the advice around pregnancy, fertility and breastfeeding has changed due to the speed of rollout. And I know it can feel very difficult when someone's told not to have a vaccine for a reason and then they're encouraged to have it. I absolutely understand why that would lead to multiple additional questions, but I'm going to talk about where we're at now with regards to those three issues, both all of pregnancy, breastfeeding and fertility. So the latest advice from the JCVI is that COVID-19 vaccines should be considered for pregnant women when their risk of exposure to the virus is high, and that exposure cannot be avoided, or if a woman has an underlying health condition that puts her at higher risk of complications from having COVID-19. So COVID-19 vaccine should only be considered in pregnancy if the benefits outweigh any potential risks for the woman and for her baby. Big decisions to make for pregnant women, and where do you get help with this? Well, I would absolutely encourage anyone to talk with their midwife or their obstetrician in helping them make that decision. They'll absolutely explore your individual circumstances. And for those with underlying health conditions, or those, for example, from a BAME origin, I would particularly encourage them to have that conversation. To reiterate though, pregnancy does not need to be avoided after vaccination, and there's no evidence fertility will be affected. There's no biologically plausible mechanism by which the current vaccines would have an impact on fertility. And the other issue is breastfeeding, and breastfeeding does not need to be ceased for vaccine administration. So all of that advice comes from both the Royal College of Obstetricians and Gynecologists, the Royal College of Midwives, and from the JCVI. So that is the current state of play with vaccination and fertility, pregnancy and breastfeeding. If I could have the next slide, please. Now this slide, I can't even recall what it felt like back in December when we looked at this slide, and probably couldn't even imagine what it would be like to get to the end of these cohorts, and how exciting that basically with first offer of vaccine we are at the end of these cohorts. So Alex has touched briefly on this. This is where we are now. We're just about at the end of cohort 9, and the offer has been made today, as we've heard, for people under 50, which is absolutely indicative of how well we have progressed through these groups in what I hope people will see as a totally logical order. There was much questioning at the outset about the rollout and why certain groups are being done in priority over other groups, but that feels sort of a bit dim and distant now, and I hope that the rollout has been entirely appropriate. So I can have the next slide, please. So exciting day today, and we didn't know this was going to happen when it was scheduled for today, but this momentous moment has come. The scheduling of we've gone outside of the original 9 groups now, and there's been an offer made to people who are over 45, so the 45 to 50-year-olds, to log on to the National Booking Service, or to call 119 and book an appointment. And this is probably come about because we now have the third vaccine, the Moderna vaccine, available to us. And for Plymouth specifically, we're very excited to be one of the very few places at this stage who have been given an allocation of Moderna. So we've talked very honestly with you about the fact that we were at one point feeling that we might not be giving any first vaccines during the month of April, apart from those with them already booked. But it is absolutely worth now people watching that national booking system, and if they get an invitation to call or to contact and book an appointment, there are first vaccines that are now going to be available through April on literally on an availability of this new Moderna vaccine coming to us, which we are getting in small but relevant quantities that are enabling us to open up booking slots for people to attend to have the Moderna vaccine. So a really exciting time, and again something that's putting us perhaps slightly ahead of some of our neighbours. We'll all get to the same point at the same time, but that doesn't mean that we won't rejoice being in that position for Plymouth at the moment. So if I could have the next slide, please. And I think it's worth us just taking a breath and pausing and celebrating all that's happened. The figures for Plymouth, I'm sure we all saw the national news headlines that put the Southwest at the top performing area over the course of the weekend. And here's where we are absolutely locally. Takes us right back to that time in December where Derriford Hospital was allocated as a tranche 1 hospital. So we were absolutely on the first day of availability able to start giving vaccines. That put us in a really, really good position. And then looking at the Western Morning News there, Dennis, who became our cover boy, who was one of the first to have the vaccine, being vaccinated by Emma, one of our vaccinators there. So an amazing, it is just worth pausing and thinking that this whole system approach, so primary care, our GP colleagues working with us at the hospital, working with these pop-up mass vaccination sites, and the achievement that has been more than 127,000 vaccines given across Plymouth so far. Next slide, please. So some pictures which I will leave you to ponder, and I'll mention in a moment. So what happens? This might have already happened to you, or it might be something that you're waiting to happen. How will you know when it's your turn, and what does vaccine rollout look like? Well, there's a few ways that you might hear that it's your turn, or might have heard that it's your turn to attend for vaccination. One of those might be a contact from the hospital. It might be a contact from your GP, or it might be the largest part of the population, it might be that you receive a letter from the national booking system inviting you to book. And what we really want to do is make sure that it's as easy as possible for people to attend. And there's many centres across Plymouth, some of them listed there, as well as there'll be some smaller options, some smaller offers made through individual practices as well, but the larger facilities are there. Worth mentioning in the context of the national letter that you receive, that will mean that you can book onto the system to attend one of the what are actually called large-scale vaccination sites. We know them as mass vaccination sites, and the one being relevant being at Home Park, and very soon, literally within the next 3 weeks, as well as having the option to go on that national booking system and book into Home Park, I'm delighted to say that Derriford Hospital will also be a large-scale vaccination site as well, so we'll give people more choice about where they can go on that system and book, and we're really hoping that makes it as easy as possible for people. What we do ask is you only accept one offer, so you might get multiple offers, and that's great because we want to make sure everyone does receive an offer. But if you get an offer for vaccine, please just book in one place, or if you did book into if you did suddenly want to change your mind, for example, you've booked into Home Park and then you get an offer from your GP and it's far more convenient to attend your GP, just please make sure you cancel that original appointment. Or if you've got the offer with your GP and you've always wondered what it looks like inside Home Park, and the bottom picture there is the rather converted Home Park at the moment, then please make sure you cancel with your GP. We've got absolutely no problem with people deciding that they want to change, but we genuinely, without going into the rather boring detail about how the vaccine needs to be prepared, we genuinely do prepare the amount of vaccine each day for the amount of people we have booked in, and it can lead to wasted vaccine if we don't have the right number of people attend that we were expecting in that day. So a little plea around cancellation if you change your mind about where you're attending. Go to the next slide, please. So some vaccination highlights in Plymouth, and they're pretty self-explanatory. I'll just talk you through a couple of them. I had the pleasure, and it really was a pleasure, because we hear where there is vaccine hesitancy, a phrase that we use quite a lot, to go and speak to some people very honestly at a large, I say speak, I obviously mean via the same mechanism as we're all talking tonight. I wasn't actually there, but speak with a large panel of people who were attending a church service in an area where there was particular vaccine hesitancy, and able to really talk about some of those myths and allow some of those parishioners to be able to express exactly how they were feeling about the vaccine alongside some colleagues. And I was delighted afterwards to receive several emails from people who had been in attendance to say that having the opportunity to air their concerns that night had been the turning point for them, the conduit to making them go forward and have a vaccine. We've done an awful lot, and as I say, it has been a real sort of changing climate with regards to the advice for women of childbearing age, and I do really feel for this group of the population at the moment, because the advice has changed and it's a difficult decision for us all, but let alone when you're making a decision about getting pregnant and fertility. So we have done a huge amount of work with having Charlotte Wilton, who is the acting head of midwifery at University Hospitals Plymouth, do some promotional work, providing the detail from the Royal Colleges with the up-to-date advice for women of childbearing age. You can see that we've done some specific work with communities, and that really relevant one, working closely with Healthwatch in Plymouth to understand patient experience, because it sometimes is around people's experience of attending for vaccine and what that was like that is going to be the shall I or shan't I factor in whether an individual attends. So that has been really, really helpful for us. Next slide, please. So vaccine should never be vaccine for vaccine's sake. It's an absolute opportunity to look at individuals holistically. And when we've looked at the GP-led outreach vaccination events, particularly for those who experience homelessness in Plymouth, there has been many pluses that have come from accessing that particular community. And I will leave those bullet points there just for you to scan through for a moment. I don't think you particularly need me to read them out, but some real advantages of being able to access those experiencing homelessness in Plymouth. And absolutely worth saying, I would put it high up there in the questions that I'm regularly asked. Do I need to be registered with a GP to have a vaccine? The answer is absolutely not. There is absolute ease of vaccine for those who are not registered with a GP. We will of course use it as an opportunity to encourage people to register at the juncture that they have their vaccine, but we can, if people choose not to be registered with a GP, we can absolutely still offer a vaccine. So please don't let that be something that holds anyone back. Next slide, please. So before we go over to questions and learn everything that we'd forgotten to tell you about, the summary is hopefully that Alex has been able to make clear that the vaccines are effective. Appreciate the plethora of information that's out there, all of the different statistics and figures that relate to the effectiveness of vaccines, but hopefully some of the slides that Ruth showed us earlier on, there could be no reason other than vaccine that we're seeing such a drop. The benefits really do outweigh the risks, but we appreciate it's not as simple as that sentence, and that everyone who has a question should absolutely come forward and have those answered. That blanket statement doesn't mean that we don't want to do that. I want to come back to that earlier point. We are asking people to do something not just for the benefit of themselves and their loved ones, but the wider population. And it is the best step we have to returning to some form of normality. In individuals having vaccines, we support and protect each other. So I will hand back over to our chair, Tony. Thanks, Tony.
Thanks, Sue, and thanks, Alex. I hope you agree that was quite an informative presentation, and we have run slightly over on time with that, but I think it was important that Sue and Alex could get that information across to you. We're about to go into a question and answer session, and the way I want that to work is if you could put a virtual hand up if you have a question. I'll be able to see that in our chat bar, and I can see that Douglas and Shirley have already submitted their hands. Before we do that though, I'd like to ask a question of the panel, and I'll direct this one to Sue. It's from a lady from Rachel, who's unfortunately had to leave us because she's got a young one to put to bed. But it's a specific question around pregnancy, as she's currently pregnant. And a question, and it's one of 4 or 5 that perhaps we can pick up after the meeting and get a response to Rachel, is I'm currently pregnant. At what point after giving birth can you safely have the vaccine?
So, as I said, the vaccine is safe when women are breastfeeding, so after delivery, and we are asking for women to have an individualized conversation for that postnatal period with regards to the balance of their own personal situation and their own personal risks. But the vaccine is safe once straight after delivery. There will be some factors depending on how well people recover, what we might recommend, but all of our obstetricians are using the RCOG guidance to talk to women at the point of post-delivery if they are thinking about having a vaccine at that stage. So the advice will be here and available for Rachel in the organisation as and when.
Thank you, Sue. So to the first question from tonight's audience, if I can use that term, I'd like to go to Douglas Kerr. Douglas, once you're unmuted, if you can just address your question to the panel, please.
Douglas, you should have received an invite to unmute.
Yep, there you go. Thank you very much. It was a very interesting panel discussion. I'd like to put a question to either of the experts. I just recently received a kidney transplant 3 weeks ago, and while in recovery in the ward, I read the latest JCVI information that people living with people who are immunosuppressed had to be vaccinated as soon as possible. Was that to be vaccinated both doses or just for the 1 dose? And again, I seen a patient's letter today on social media, a kidney patient who received the same letter of information saying that anyone over 16 living with immunosuppressed patients had to be vaccinated. I'm just wondering how you go about pursuing this information, as I've tried to make a few phone calls and questions towards people, but no one seems to know much about it. Thank you.
Alex, would you be able to take that one?
Yes, if I could do the second one first. So I think there's some guidance that came out last week, I believe, Douglas, that said that anyone over the age of 16 who lived with anyone who was immunosuppressed was entitled to be vaccinated. Now I know that message has been sent out. I'm sure that the mass vaccination site at Home Park and Sue's team will be aware of that, and that information has been sent to GP practices as well who are involved in the vaccination programme. So I think my advice to you would probably be in the first instance to contact your GP practice, and hopefully they will be able to arrange immunisation for those individuals. With regards to renal transplantation, sorry, I'm a bit hazy on the guidance around that, but I think that anyone who has or is going to have a renal transplant should have 2 vaccinations within short succession. I'm looking towards Ruth because she looked like she might have been going to help me out with that question.
I can help that.
I was going to say, I'm afraid I don't know the detail. I'm just trying to get it up on the screen. But Sue may be able to.
Yes, thank you. Yeah, we work with our colleagues in transplant, and we offer a truncated programme for those who are in that position, and we administer the 2 doses within a 3-week period.
Thank you, panel. Hopefully, Douglas, that answers those questions. you should hopefully now be able to get your vaccinations through. I'd like to go to Shirley next, please.
Oh, good evening. Thank you very much. It's been quite informative. I've got a question. I had the first vaccination in February, and then due my second one in 3 weeks. After the first vaccination, I had really bad headache, and I then had a big red mark on my arm, the size of a golf ball, and it was bright red. And the doctor put me on antibiotics. And then I went on antihistamines. That mark was on my arm for 6 weeks. And I'm now left still with a bruise. And it sort of hurts sometimes and pulsates. So I don't know, is that a normal side effect?
Tony, do you want me to come in on that? Thanks. Thank you, Shirley. Sorry, there was a bit of feedback there, so I didn't get it completely, but I think what you were saying was you had a reaction in your arm, so you had a lump and your GP gave you some antibiotics, but several weeks later you're still left with a bruise. Is that right? Can you nod or shake? Yeah, so it's difficult without having a look personally to be sure. I think that the reaction that you described there, in my experience, is relatively unusual, but we do get kind of the odd rare but not serious side effect. I think if after several weeks it's still there and it hasn't resolved, I'd probably advise that you contact your GP again to have a conversation with him or her, and just to assess whether anything else needs doing about it. But by the sound of it, although it's not something we choose to have happened, it's probably relatively minor and unlikely to cause any long-term problem for you. Shall I hand back to you, Tony?
Yes, thanks, Alex. Shirley, can you nod if that answered your question? Could we unmute Shirley again, just to follow up on that, please?
Yeah, no problem. I'll unmute Shirley now. I think the feedback is because maybe Shirley's logged in twice. No, but I will unmute now. We might get the loud noise again. Shirley, you should be able to unmute now. Yeah. No, I think it's because Shirley's logged in twice. Shirley, you should be able to unmute. Are you getting an alert saying unmute? No, I think. Hang on.
Ellie, I'm happy for you to give Shirley my email address, and if Shirley contacts me directly, I'm happy to either email her or have a conversation with her to answer her question.
No problem, I can do that.
Is that okay, Shirley?
Thanks, Alex. Next on the list is Ella.
Hi, can you hear me?
Yes, we can.
Yeah. Hi. I have two questions, actually. So, like many women, I was recently diagnosed with endometriosis, and I haven't really seen any information about getting the vaccine as someone who has endo. So I was just wondering if there's sort of any risks in terms of the blood clotting. My mum's a little bit concerned about it. That's my first question. My second question is, you can probably tell from my accent that I'm not from here. So I was just wondering, as someone who's currently in the UK on a working visa, will I still be offered the vaccine like everybody else, or you know, is there like a process that I have to go through? Thank you.
I can do that, Tony, if you want. So, Ella, I'm not aware of any increased risk with regards to your endometriosis and blood clots. Is the answer to the first one. And with regards to the second one, yeah, even if you're here temporarily, you're entitled to a vaccine or two vaccines, your first and your second one, if you're here long enough. And I'd encourage you to take it up.
Thanks, Ella. Seeing the thumbs up. Next, I'd like to go to Andy, please.
Hi, I have two questions. Do you want me to say them both at once, or do you want to answer one first?
Give us both questions at once.
Okay. So when you get sick, your body learns how to combat a virus and stores this information for later use. And these antibodies become present in the blood when exposed to the same virus. In the same way, a vaccine is a means by which a body can learn how to combat a virus with minimal risk of them getting sick from the same virus during this learning process. I've researched this. I've studied anatomy and physiology for a few years now, and I've done a lot of research specific to this situation, and have found evidence from the CDC, Science Today, and many more websites that all say the same thing that I've just said about antibodies. I have also seen evidence to say that natural antibodies could possibly be better than vaccine antibodies, as they were made naturally and reduce the risk of vaccine dependency, which limits your natural ability to combat illnesses. So however antibodies are produced, the antibodies are what reduces the spread of the virus. Since antibodies are stored in the body when there is no longer a threat of the same virus, this could be a reason why some people who have had COVID are not showing antibodies in their blood from either COVID or the vaccine after a period of time. Therefore, the question is, can you explain why should anyone who has had COVID take the vaccine? And then my second question is, when there's no evidence either way to say if the COVID vaccine does or does not affect fertility in humans, and the NHS and government website does not give any information, they simply say to seek advice from a medical professional, what advice would you give a couple who are planning to start a family and have already had the virus?
Thanks, Andy. Alex, would you certainly take the first one, and Sue, could you take the second question?
Actually, I think Ruth might want to come in on those, Tony.
I don't mind. I'm sure we can all give it a go. But yes, I'll certainly start the answer. So that's such a good question, a very, very good question about whether natural immunity through getting a virus itself is equivalent to the immunity that you get from having a vaccination to that virus. So that's a great question. What we think we are, or what we're beginning to learn at the moment, is that the naturally occurring antibodies that you get from COVID appear to wane. Now, we don't know exactly how much by or how quickly, but we know that they do. And a good example of that is if you look at the issues that Brazil are facing at the moment. The P1 variant at the moment is running amok particularly because people that they thought were immune because they'd already had an infection are now getting it again. So there are some, and the vaccination appears to still be giving some protection. So there appears to be some evidence that whilst you're absolutely right, natural immunity gives you some protection against COVID for a certain time of which nobody quite knows. It's very uncontrolled. It's a bit like saying you're going to chew some willow sticks rather than taking an aspirin, because we just don't know. We don't know quite how well your immune system's responded. We don't really know quite how strong the immune response is, the antibodies, the T cells, etc. Whereas with the vaccine, we do know. We know a lot more about it, and it's also possible, of course, that the vaccine, the protection against the virus from the vaccine will wane as well at some point. But the evidence at the moment is that it will be better than natural immunity. So that is the main reason to have the vaccine. Even if you have had a history of COVID, If you've had it, in the wave 1, wave 2, the chances are that your antibodies will be waning. And what you don't want is to, especially if it's a couple, as you say, that are trying for a family, you don't want to have to, you don't want to get pregnant and then find that your antibodies have waned, and then you're leaving yourselves exposed to COVID. So my advice is to have the vaccine, to have the vaccine before you get pregnant, before your natural antibodies wane, so that you've got that level of protection. I'm sure Alex or Sue may want to come in with more.
My point was going to be very similar. I'd actually call it the optimum time to be having the vaccine in this period where you're considering pregnancy, a planned pregnancy, and it is the time to boost that natural immunity, rather than finding at the pivotal time of pregnancy itself, when we only recommend the vaccine if the balances outweigh everything else. It's not putting you in that vulnerable position. So I would advocate exactly the same.
Tony, can I just add? I'd concur with Ruth and Sue, but I suppose the other thing, just to add in, is that actually, I know there are some kind of newer technology around some of the vaccines, like Pfizer, like Pfizer and Moderna, but the AstraZeneca vaccine is based very much on kind of traditional vaccination. So vaccination technology that has been around for years and used for lots of other vaccines that we use. And we know that those vaccines are safe in pregnancy because we've been using them for years. So hopefully, Andy, that'll reassure you a bit as well. But yeah, I concur with Ruth and Sue that my advice would be to get vaccinated as quickly as possible.
Thanks, panel. Andy, hopefully that gives you some answers to the 2 questions you had. Before I bring somebody else in, I've got a question in the chat that I'd like to read out to the panel, and it's to do with serious side effects of the vaccine. It's from Andy Hallett, and he says, how do the more serious side effects for the vaccine compare to other medications such as paracetamol or ibuprofen, which people take without hesitation? Is it a case of educating the population as to the comparable risks?
I can do that one, Tony. That's a really, really good question, Andy. And I don't have the figures to hand, but you're absolutely right. Some of those medications that we buy over the counter, like paracetamol, ibuprofen, naproxen, they can all have potentially serious side effects. And actually many of us don't think twice about popping some of them if we've got a headache. As I said, I don't have the figures to hand, but I suspect that the risk from a lot of those medications is substantially more than any theoretical risk with the vaccination. I don't know whether, Ruth, can you add anything on that?
No, to be honest, I agree with what you're saying. I don't have any actual figures for those kind of medications, but you're absolutely right. When people assess risk in their mind, people are always much more fearful of new things. And assume that it feels more risky because it's new, and so that probably explains why we're quite happy to take so many of those drugs that have been around for a long time, but worry more about something that's relatively new, even though it's been through such rigorous testing.
Thank you, Ruth. Next, I'd like to go to Eleanor, please.
Hello.
Hi, Eleanor.
Hello. This is to do with my vaccination, and I've got a concern because I had my vaccination, but I am clinically extremely vulnerable, which meant that I've spent most of the last year, indoors. Now, before this, I have suffered with agoraphobia, and this has only just made it worse. Now, when I had to go for my vaccination, I contacted my doctor to say, could I have it at the surgery? And he said, no, we don't do it. And I had to go up to Home Park. Well, queuing, there was a queue there, and I found that extremely distressing. And I'm going for my next vaccination at the end of April. And I'm really not looking forward to it, really. And I wonder if there's any provision for the clinically extreme in this, because I think it's done a lot of damage for people to be left at home, for a year without going out and not seeing relatives and that.
Do you want me to come in on that, Tony, and then I might hand over to Sue on the specific. But Eleanor, thanks for telling your story, and actually it resonates with me, because I've seen lots of patients, particularly those that are clinically extremely vulnerable and very elderly, who have stayed at home for the last year. I think it's back in February when I was vaccinating. I vaccinated someone who was 90, and it was their first time out of their house since March last year. So quite understandably, people are apprehensive. It's affected people's mental health. So it absolutely resonates with me. I just wonder, Sue, if I hand over to you, is there anything in particular you can suggest with regard to Eleanor's second vaccination?
Yeah, absolutely. Eleanor, sorry to hear that you had a queuing situation at Home Park. We really are trying to make it an experience that is suitable for different people. So for some people it's not a problem to queue, they're happy to have a bit of a chat with people first time out, but for others there must be nothing worse than having been indoors for all that period of time and suddenly exposed to an awful lot of people in a queuing situation, when the reason that you've been indoors is because we've told you and emphasised that you're extremely vulnerable. We really do encourage people to contact us beforehand, and we will do everything we can to see people through that process incredibly quickly and incredibly efficiently when they're in your position. And I will ask my colleagues to get your details, and I'll personally get in touch with you, and we'll make sure that experience for you is much better when you go back at the end of the month.
Oh, thank you very much.
Thank you, Eleanor. Could we move on to Denise, please?
Hi, sorry, can you hear me?
Yes, we can, Denise.
Right, sorry, thank you. Yes, it's been reported that just because you've had both vaccines, you're still quite susceptible to catching the COVID and also transmitting it. So for people like myself who haven't yet had the vaccine and are a bit reluctant to do so, and I know you're going to tell me I should do, it's intimated to me that I'm being selfish and not helping other people. But if I was in a room with other people that have been vaccinated twice, why are they more at risk from me than I am from them? Can someone just explain that to me, please?
Ruth?
Hello. Yes, I can give that one a go. So the point of the vaccine is, as I think you've reflected that you realise, is that first of all it stops people becoming seriously ill. So it does stop cases, but it really stops people dying. And that Alex mentioned earlier that the estimates at the moment are just over 6,000 people's lives have been saved from the vaccine programme already. So I mean that is fantastic. And there also is a reduction in transmission by the looks of the information that we're getting, but it doesn't stop you transmitting it completely, and it doesn't stop you catching it completely. So with all of this, it's always a little bit, we're always looking at a game of numbers, and even if it's, the effectiveness is in the high 90s, in terms of percents, there's still going to be 1 or 2 people in 100 who will still get seriously ill from this, even if they've been vaccinated. So we do need to make sure that we are keeping people as free from COVID as possible, because that is quite a a toss of the dice, a throw of the dice, if you like. So even if you're somebody who's being vaccinated, you still want to keep yourself protected from catching COVID again, because the risks are much, much lower that you're going to be seriously ill and die from it, but they are still risks. And that's why we want as many people as we can possibly get to be vaccinated. Now, at the moment, it looks like there's a relatively small group of people who perhaps can't have the vaccine, or it might be advisable for them to wait for having the vaccine. So we talked about pregnancy being, you know, not while you're actually pregnant. What I don't think is quite so clear, although Alex may know more, or Sue may come in with more on this, is that some people, their immune system, it does wane a bit when you get older and more vulnerable. And so that's another reason why we want to keep them protected, even if they've had the vaccine. So those two reasons are why we want to get everybody, as many people as vaccinated as possible. The take-up's been great so far, but we want to get as many people as we possibly can vaccinated. But we still need people to be protecting each other until we get to the stage where, you know, where we have managed to get COVID being, if not 100% a thing of the past, then at least at such very low numbers that people aren't being exposed to it. So I know that sounds incredibly cautious, because it would be lovely to say, if you're vaccinated, tick, you won't catch COVID, but that isn't the case. It's a very small chance that you'll get it, but there is still that chance there. Does that help? Is that good enough?
Sorry, yes, it sort of gives me an explanation. Yeah, okay, thank you.
You want me to add a little bit?
Yeah.
Sorry, Ruth was just talking about immunity as we get. I use the term more mature rather than older, but as we get more mature, our immune systems are probably less good than when we're younger. So I have to confess, I haven't read the evidence around this, but I suspect that it's really important that we vaccinate the most vulnerable, so those with medical conditions and the most mature in our society. But if we look on a population basis, the immune response from the vaccine will probably be a little bit lower in our elderly population, or those that are on some medications that reduce our immune system. And so that's another reason why it's from a population point of view, it's important we vaccinate as many of the population as we can to keep the level of circulating virus in our community in Plymouth as low as possible, and protect as many people as we can.
Thank you,
Alex. I've got another question in the chat. Sue, I'm going to ask you to come back on this one. It's from Naomi. It says, "Hi, I'm sorry if I've missed this information, but are you able to say when appointments for first doses of the vaccine will be available again to eligible groups, e.g. newly started staff within health and social care?" Naomi's had to put it in the chat because she's got no camera and mic, so but obviously can hear us.
Lovely, and hi, and thanks, Naomi. So sort of two parts to that, because there's a different answer for the general population to the specifics of health and social care workers. So we have a small amount of vaccine available to us in April, and that is very much for people who suddenly are working within the health and social care setting, people who are suddenly diagnosed as being clinically extremely vulnerable, etc. So vaccine for people in those groups should not be a problem at all. And should be available. And if anyone is not able to access it through the national booking system, but is able to prove that they fall into that specific group, we can provide a vaccine through UHP for health and social care workers. And we can, anyone can contact, I'll put my contact details directly if that is your specific situation, Naomi. As for the general population and people who are eligible for first vaccines, just to reiterate, as I said in my presentation, we had thought we were going to have to say a blanket no through April, but because of the availability of the Moderna vaccine now, we are able to open up booking slots for people having first vaccinations, and they will be somewhat sporadic, and that is linked with when we get vaccine and when we don't have vaccine. vaccine. So if someone is eligible and has that invite to book, I'd absolutely encourage them to keep an eye on the national booking system. If I tell you that we opened up quite a large number of appointments yesterday, and they weren't all booked into, so there are appointments there for the taking if anyone has that invite to book and hasn't yet had that. You just do need to keep a little bit of an eye on it. It sounds like I'm doing some kind of dreadful promotion, but when they're gone, they're gone. So we have a limited amount of vaccine, and the appointments will get booked up, but just keep an eye.
Thanks, Sue. Next, could we go to Rowan?
Hi, thank you. So I'm a university student at Marjon, and basically I'm writing about this meeting for university students at Marjon, just so that we are kind of aware, like kind of motivating everyone just to get the vaccine because it's so important. But obviously in this, yes, it's brilliant. I'm so excited to write it actually. But in this, obviously it said under 50s, I believe, would be vaccinated by the end of July, if I'm correct, something along that line. That's kind of the aim. But university students go home at different times. So I know my degree ends in May, and then my housemates end in July, and our rents differ, or like our kind of rental agreements. So would it be kind of smart for us to stay at university, to stay in our rentals, and to try and talk to our kind of accommodation people and be like, can we stay until we're vaccinated? Would this kind of be a smart idea? Make sure we're all in the same area. And also, I'm just a little bit confused about, you know how you were saying basically when it's kind of our time to get vaccinated, we'll get like a message or something like that, basically saying you can get vaccinated. Like, how does this work? Do we like basically, I'm sorry, I'm getting a little bit confused with it. As in, so we get a message basically saying you can vaccinate, and then like we can get vaccinated, and then we just kind of like go onto a website or something and we type in where we are, because a lot of people will be in different places now. So I'm obviously booked in at the GP down here, I'm booked in at Elm, but if my rent can't be extended, then I'll be back home in Somerset. And I was just wondering, like, all of these kind of things.
Tony, I can come in on that. Thanks, Rowan, for a really good question, and I think it's something we're going to need to think about actually and come up with a solution. So, in answer to your question about how you will get invited, you could be invited in any number of ways. So you might get a letter from the NHS centrally. You might be invited by your GP practice, and if you're a student, some students are registered with a GP in Plymouth, whereas actually some might be registered at their hometown. And I know, having been a student for many years in the past, that actually in the summer a lot of people are keen to get back to their family and friends. So I think what I might suggest, and I'm going to look at Sue. Hopefully she'll nod when I say this, but there's a program board that looks at the that's running the vaccination program for the whole of Devon. And I think probably what we should do would be to for Sue and I to take the question back to the program board and try and work out a solution and communicate that not just to you in Marjon, but to the other universities across Devon as well, because as I said, I'm sure many of you want to get back home to see your family and friends after what I can only imagine has been quite a difficult term. So we'll undertake. I think I saw Ruth and Sue nod into that. So we'll take that back and get something out to the universities in due course.
Brilliant, thank you.
Thank you, Rowan. Noting the time, and actually we've only got one hand left up in the chat. I'd like to go finally to Arthur before we draw this Q&A session to a close. So over to Arthur Watson.
Oh yes, hello. Is this working? I've never done it before.
Yes. Yeah.
All rightio. A couple of questions really. as you can see, I'm ancient, 72 on Friday, and have a heart condition, atrial fibrillation. And I have been a participant in the Jensen vaccine trials in Plymouth, meaning I've had 2 doses of that experimental vaccine. And the news today was saying that it's being called in America because there have been some clotting problems with people on it. And I was wondering if you could say anything about implications for me and whether I should consider having the government's offer of another vaccine on top of the 2 I've already had. If you see what I mean.
Do you want me to have a go at that, Ruth, or do you want?
If you can,
Okay. So I think, Arthur, if my advice would be, that there are different types of COVID vaccine trials. So some people will have been randomized. So some people will have had a placebo injection, and some will actually have had the vaccine. From what you're saying, it sounds like you had the.
I have been unblinded, and I am on the genuine thing.
Fine. So in that case, the advice at the moment would be that actually you don't have another vaccine as part of the rollout. I don't think you need another one on top of that.
Right.
One thing that I was half expecting to be asked today, but I can cover now actually is what might happen later on in the year. So
yeah.
People have been asking me about booster vaccine or booster doses and whether we'll need to have an annual vaccination, a bit like the flu jab. And I think at the moment we're not completely clear what's going to happen, but I think it's likely that that there will be some kind of booster vaccination later in the year, and potentially we may need an annual jab alongside our flu.
Right. I understand. But we can be on to another aspect. I've been trying to follow this pandemic as best I can, but are there any in long-term problems about wildlife reservoirs of this virus? Because I gather that in Denmark they've had to exterminate all the mink farms, and the vaccine, the virus can be carried in cats and other animals. In Plymouth, of course, we have beavers, and there are probably mink. And in my garden, regularly, there are deer. I'm just wondering whether this is going to be a problem in the future, reservoirs in the wildlife.
I have to say that's not a question I was expecting to be asked today, but Ruth has unmuted herself, so it looks like we might be able to have a stab at answering that.
Yeah, I've slightly optimistically unmuted myself, thinking I might be able to help. I mean, you're absolutely right. These are the kind of things that we have a bit of concern about. Possibly not even this virus, but other coronaviruses, because of course they do all come from animals in the first place. They are zoonotic. So whether whether potentially there's a risk of a different virus coming through. And as you say, then you add in these complications about if the coronavirus goes into an animal host, and as you say, sort of finds a host there that it can live in quite happily, does it then mutate and then come back to humans in a very slightly different form, which might be different enough that it causes more significant issues? All of these things are very valid questions. I'm not aware that there's any imminent threat like that or any imminent concern of something like that having happened with this coronavirus at the moment. But all of these things are a real worry, and that sense of we're in the middle of this pandemic. Well, hopefully we're towards the end. I don't know. I'd like to be optimistic and say rather than the middle, we're towards the end. But actually, we constantly need to be looking out for the next pandemic coming and trying to stop it in its tracks if possible. So, an excellent question. As I said, I don't think there's an imminent threat of that, but it is definitely the kind of possibility that people are looking into, along with the possibility of other coronaviruses coming from animal hosts. I feel like I'm being very negative, actually, if that's the last comment.
I think it's a difficult one. Andy, does that kind of answer?
Arthur.
Sorry, Arthur. Andy on the mind.
I think Arthur may
have I unmuted?
Oh,
I think I've unmuted. Complicated, this silver surfer. But thank you. But keeping it to the human side of things, we are into a period of the year where a lot of people come west. And of course, there are businesses carrying on the massive road construction project near where I live. And I get a bit worried about this effect and whether the lockdown is going to control the virus once people start moving around, thinking that the summer's here, they'll have a holiday.
Again, really valid comments, and I think valid concerns as well. There are so many things we don't properly understand about coronavirus even so far, and one of those is whether it's a little bit like flu in that we really see a seasonal effect, or in fact whether it's more just our behaviour changes in the summer, and the push for us all being outside, of course, is to reduce risk. So the more of us that are meeting outside, the lower the risk. Of course, in the winter we tend to be in warm, cosy rooms with doors closed and windows closed and keeping warm, so the risks are much higher there. It's obviously a bit of a concern when lots of people are moving around the country, because that always means that you've got the opportunity to be infected by different people, unfortunately. And that's why we're probably going to have to keep at least some of the measures going for the time being. And I know that I'm sort of double answering questions here, because I know that Andy's been asking a little bit there about, you know, how does this pandemic come to an end? And what we're hoping will happen is that over the summer we will continue to see a reduction in cases. We'll see the real impact of the vaccination programme really kicking in, because by that stage hopefully we'll have vaccinated you know, a large proportion. No one's quite sure exactly what number we have to hit for herd immunity, but hopefully it may not be too long before we're starting to see some of the positive effects. If we start to see a real dampening down of the number of cases, and then there will be, just like we've reviewed when's the time to open up shops and come out of the lockdown, there'll also be reviews on things like social distancing measures and wearing masks to understand when is the right time to stop doing those. And you know, there will be a point where we are back to normal. I'm not going to say it's 100% exactly the same, because it might be that we're only back to normal because enough people keep being vaccinated, but there will come a time, and we will get there, when we're not having to live like this. And when people going on holiday won't feel quite so concerning. But you're right. I think over this summer there will be some concerns. We may see some increases and some reductions as people come and go, possibly, of course, people going on international holidays and bringing it back in. There will be lots of things like that will happen. But what we're hoping is that those things will be ripples on the surface rather than a tsunami, which we've had over the last year. And as we move forward through the pandemic, those waves will become smaller and smaller and smaller, until eventually we're at the point where all of the measures, except for possibly vaccination, because I think that's one that probably will continue, will be able to be reduced, and hopefully then we'll be out of it all. So that's what I'm hoping, but it's too soon to drop all of the precautions just yet.
Thank you, Ruth. Well, we've overrun a little bit for tonight, but I'd like to thank everybody who's attended this question and answer session. And for those that posed questions, there were some really good questions there that were thought-provoking. I've noticed in our chat, we've got a few follow-up comments and queries that we will respond to via emails that people use to register for the event. And we'll make sure we get some answers back to you on that. But once again, I'd like to thank everybody for attending tonight. I hope you found it informative. I hope that you've got some answers to the questions that you've asked and can have some more confidence around the COVID vaccination and the process of the vaccination. So I'd like to wish you all a good evening, and I hope you have a pleasant what's left of the evening.